Today marks 1 year since UW Hospital treated its first patient experiencing symptoms of what was then a new virus. Testing would later prove that patient was the state's first case of COVID-19 and the 12th overall in the U.S. Gabriela Becerra reflects on the past year of the pandemic with Madison Mayor Satya Rhodes Conway and other key figures leading the fight against the virus in south central Wisconsin.
We all have our own ways of remembering.
I started keeping a little notebook with just sort of notes about, events or milestones in the pandemic.
The first time Madison Mayor Satya Rhodes Conway and other local leaders addressed COVID-19 was on February 5th, 2020, less than a week after a person first reported symptoms of a new virus in UW's emergency room.
A person's chances of getting sick from this novel coronavirus remains very low.
It didn't stay that way for long, with more than 540,000 cases in Wisconsin just 1 year later.
At the beginning, we were just trying to understand how is this thing transmitted? How do we protect ourselves? How do we protect people? What are risky behaviors?
City offices began closing, and by March 13th, Public Health Madison and Dane County Director Janelle Heinrich issued the first order in the state, restricting gatherings of 250 people or more. Less than 2 days after that, schools closed and gatherings were down to just 50 people.
It was a little overwhelming because it was all happening at the same time, right? Reviewing the information that had just emerged to then translate that into something that we would communicate out to the public within hours.
After 2 months of Governor Tony Evers' statewide Safer at Home order, it was struck down by the Wisconsin Supreme Court on May 13th. But Dane County immediately issued a similar local order, followed by 11 others that have been in place ever since.
I have never questioned whether or not we should have done the orders that we did and been as aggressive as we were from the beginning. I assumed that everyone else would be too.
Dane County Executive Joe Parisi, Rhodes Conway, and Heinrich all agree the hardest part of fighting a pandemic is doing it alone.
We've been an island. And that you see, in surrounding counties and across the state, that there have been much looser restrictions. And that's, I think, has been, frankly, it's been a source of infection.
But throughout a year of losses, there's been victories worth celebrating. Testing, once a limited and long process, now completed locally with ease.
Calling down and saying, you said the result might be ready in 3 hours and it's taking longer and we need this information. And now, there's a lab right down the street.
Healthcare systems adapted to treat patients unable to leave their homes.
Telemedicine, virtual visits, making sure that there were protocols in the health system to keep people safe.
Neighbors helped neighbors.
As long as we're all looking out for one another, there'll always be someone looking out for us. And I think that's the strongest takeaway from this experience.
And although a vaccine rollout is taking longer than Wisconsinites would like, UW Health's Dr. Nasia Safdar says it's an incredible feat to get here so quickly.
That is a relatively small hurdle compared to the big thing that was done of developing it in the first place.
So when Rhodes Conway looks back through her notebook, she'll remember that leading a community through a pandemic isn't something she signed up for.
Is it something that I would have, wanted to do?
I don't think anybody would have wanted to.
Yeah, no, it's not something that you say, oh, sure, that sounds like fun.
But it's something she embraced.
But I do think that, you get the challenges that you're able to deal with. And I am proud of the way that we've handled this one.
In Madison, Gabriela Becerra, News 3 Now.